Hello, welcome to part 3 of chapter 42. We're going to talk about cataracts. So we know cataracts is related to the lens of the eye, right? The lens is transparent, elastic structure suspended behind the iris that focuses images onto the retina. A cataract is a lens opacity that distorts the image. As people age, the lens gradually loses water and increases in density. We know people with hypertension, with diabetes, and thyroid problems are at high risk of developing cataracts. The etiology cataracts might be present at birth or develop at any time. They may be age-related or caused by trauma or exposure to toxic agents. They also occur with other diseases and eye disorders. Trauma or exposure to toxic agents. Okay? Toxic agents. Think about the people that was working on the World Trade Center. Think about people that are working cleaning our parks. People that are working with cleaning with garbage. Okay? People that are cleaning the hospitals and they are exposed to these chemicals. People that are going to the park for the barbecue. Everything that can expose the eye to toxic agents can put the patient on a high risk for developing cataracts, besides the diseases and the eye disorders. Okay, people that are driving, that are biking very often, they are exposed to the wind, and the wind brings particles with different chemicals and toxins. Think about the people that works in the farms, that they have to expose themselves to pesticides. Okay, think about all that people. Sorry. Common causes of cataracts: age is the most common. Health conditions: diabetes, hypoparathyroidism, Down syndrome, chronic sunlight exposure, retinitis, glaucoma, retinal detachment. Think about your antibiotics. We spoke about Cipro. We spoke about levofloxacin. Okay, so they cause the retinal detachment. Therefore, they are in risk for cataracts. Um, that's good to know. Advanced age places the patient at a higher risk of cataracts. Advanced age. So if we remember advanced age, with the advanced age is coming the whole, that's the umbrella, right? Under that umbrella, we have the chronic conditions, we have the use of regular medications for that chronic conditions, and so on, so on, so the genetic factors, hereditary conditions like glaucoma. Okay, so age, incidence and prevalence. The age-related cataract is the most common type. By age 75, more than half of Americans have had a cataract. Half of American. How many millions are 400 millions in United States? I don't even remember, but that's a significant number. 200 people with cataracts by age 75. Wow, big business. Health promotion and maintenance. The onset of cataract formation occurs early with heavy sun exposure or exposure to other sources of ultraviolet light. Teach adults to reduce the risk of cataracts by wearing sunglasses and limit exposure to UV light where they are outdoors in the daytime. So we are mentioning this over and over. We have to protect the eye from UV light. We have to wear a protection to the head. We have to watch out what type of activities they are doing outdoors. Over and over. Think about this. Assessment, recognizing the clues. History, presence of systemic diseases like diabetes, hypothyroidism, hypertension, previous cataract or family history, history of smoking. Physical assessment, early signs and symptoms of cataract are slightly blurred vision because it's the opacity of the lens. Cataracts is opacity of the lens and decreased color perception. So there you go. You have the opacity of the lens and decreased color perfection. At first, the patient may think that his or her glasses are smudged or contacts are not fitting correctly. Okay, and that's good to know. This is good to know. This is coming in the exam. So Psychosocial assessment, loss of vision is gradual and the patient may not be aware of it until reading or driving is affected. And at that point, it's very dangerous, okay? So they are not going to pay attention to the opacity. They are not going to pay attention that they are losing their ability to identify the colors, right? And they are going to be aware until reading or driving is affected. Interventions. Take action. Surgery is the only treatment to treat cataracts and should be performed as soon as possible after vision is reduced and ADL is affected. So teach the care before and after surgery requires regular self-examination of the eye and installation of different type of eye drops several times a day for 2 to 4 weeks. That's good to know. That's pre-operative nursing care. And as I always say, focus your attention on the nursing care, pre-operative and post-operative, and all the procedures or actions that are related to safety. As to whether the patient takes any drug that affect blood clotting, such as aspirin, warfarin, clopidogrel, or dabigatran. Communicate the information to the surgeon because for some patients, these drugs may need to be discontinued before the cataract surgery. Okay, so operative procedures. The lens is often extracted by phamoemulsification. A probe is inserted through the capsule in high frequency. Sound waves break the lens into small pieces, which are then removed by suction. So here you have the picture of how the suctioning probe is inserted and the particles are being removed later. So intraocular IOL. What is IOL? IOL stands for intraocular lens. Sorry, I forgot. IOL is different from IOP. Intraocular pressure is IOP. IOL is intraocular lens. Intraocular lens is placed inside the capsule to be positioned so that light rays are focused in the retina. Okay, post-operative care. Immediately after surgery, antibiotic and steroid ointments are instilled. The patient is usually discharged within an hour after surgery, after stabilization and monitoring. Instruct the patient to wear dark glasses because we don't want the light to affect the prognosis of the surgery, uh, or in brightly lit environments until the pupil responds to light. Okay, and we are waiting for constriction of the pupil. Okay, so activities that increase intraocular pressure, bending from the waist, I'm just mentioning a few of them, vomiting, straining to have a bowel movement, sexual intercourse, wearing tight shirt collars. Remind the patient that mild eye itching is normal, as is a bloodshot appearance. The eyelid may be slightly swollen, however, significant swelling or bruising is abnormal. Cool compresses may be beneficial. Discomfort at the site is controlled with acetaminophen, which is your Tylenol, or Tylenol with oxycodone. Aspirin is avoided because it is affecting, or it could affect the blood clotting process. Pain early after surgery may indicate increased ocular pressure or hemorrhage. Okay, so that's something that you need to remember, and that's part of your nursing care postoperative. Pain in the eye can indicate increased ocular pressure or hemorrhage, and that's a no-no. Infection is a potential and serious complication. Teach the patient and family to observe for increasing eye dry redness, a decrease in vision, or an increase in tears and photophobia. Yellow or green discharge indicates infection. Sorry. Patients usually experience a dramatic improvement in vision within a day of surgery. Remind them that final best vision will not occur until 4 to 6 weeks of surgery. So after 1 hour, they are going to be discharged and probably the following day, they are going to see a dramatic improvement in vision. But the final result is going to be within 4 to 6 weeks after surgery. Action needed, nursing safety priority, instruct the patient who has cataract surgery to immediately report any reduction of vision in the eye that just had the cataract removed. So any reduction of vision and pain is a no-no, okay? Self-management education, although complications are not anticipated, teach the patient to immediately report any of the symptoms following cataract surgery. So reappearance of a bloodshot sclera after the initial appearance has cleared, decreased vision, flashes of light or floating shapes in the eye. Okay, so you are going to have a bloodshot sclera after surgery. And then this bloodshot sclera is going to disappear. But if you got another one post surgery and after you saw that this was clear, then that's a problem. Decreased vision also is a problem. Flashes of light or floating shapes seen in the eye. Many classmates during my surgery, during my nursing program, and I shared this experience with other people. We were studying so hard that sometimes we started to see flashes of light or floaters, right? So many of us had to go to the doctor to review the condition, okay? Especially the people in my class who were more than 40 years old, and they were, they were ruling out cataracts. So if you are exposed to the light of your computer without protection, okay, you are not wearing glasses and you are forcing your vision, this is what's going to happen. Remind the patients to avoid activities that can increase IOP. Cooking and light housekeeping are permitted, but vacuuming should be avoided for several weeks because of the forward flexion involved and the rapid jerky movement required. Okay. Home care considerations, the patient after cataract surgery, presence or absence of redness, tearing, or draining in the operative eye in comparison with the non-operative eye. That's something that you need to assess. Ask the patient about dark spots, increase in the number of floaters, bright flashes of lights. Okay. Pay attention to your NCLEX examination challenge questions. Okay, let's go for glaucoma. Glaucoma is a group of eye disorders resulting in an increased intraocular pressure. As described early in this chapter, the eye is a hollow organ for proper eye function. The gel in the posterior segment, the vitreous humor, and the fluid in the anterior segment is the aqueous humor, must be present in set amounts that apply pressure inside the eye to keep it ball shape. Okay. Untreated glaucoma can lead to complete loss of visual sensory perception. Glaucoma is usually painless, and the patient may be unaware of gradual vision reduction. Okay, very good. Common causes of glaucoma. The primary glaucoma is aging again, hereditary, diabetes, hypertension, severe myopia, okay, retinal detachment. This is with both retinal detachment, we can avoid the antibiotics and all these activities, and probably we can protect. Severe myopia is sometimes people, they don't want to wear glasses and they are forcing their vision, right? They are forcing their vision. Remember, the myopia is I see normal close, but far is not good. So they don't want to wear glasses. They don't want to go for eye examination. Hypertension. Sometimes your blood pressure is not under control. The same with diabetes mellitus. Okay. Secondary glaucoma, uveitis, iritis, trauma, ocular tumors, degenerative diseases like, for example, multiple sclerosis. Okay. Um, eye surgery, central retinal vein occlusion. So let's see the video about the open angle glaucoma to make the difference. At this point, we should be very familiarized with this condition.
In the healthy eye, a clear liquid called aqueous humor circulates inside the front portion of the eye. To maintain a constant healthy eye pressure, your eye continually produces a small amount of aqueous humor, and an equal amount of this fluid flows out of the eye through a microscopic drain called the trabecular meshwork in the drainage angle. If you have glaucoma, the aqueous humor does not flow through the drainage angle properly. Fluid pressure in the eye increases, and this extra force presses on the optic nerve in the back of the eye, causing damage to the nerve fibers.
Okay, so that's open angle glaucoma. And now what we're going to check is what's going on with close angle glaucoma. Okay.
In the healthy eye, a clear liquid called aqueous humor circulates inside the front portion of the eye. To maintain a constant healthy eye pressure, your eye continually produces a small amount of aqueous humor, and an equal amount of this fluid flows out of the eye through a microscopic drain called the trabecular meshwork in the drainage angle. A less common form of glaucoma, called closed angle glaucoma, occurs when the drainage angle of the eye becomes blocked. The iris, the colored part of the eye, may close off the drainage angle. People of Asian descent and those who are farsighted tend to be more at risk for developing this form of glaucoma.
Okay, it's all about the trabecular meshwork. In open angle, you have that part that helps you to drain the amount of fluid, right? But in closed angle, that part, the trabecular meshwork, is closed. Okay. Um, so in this close angle glaucoma or acute glaucoma has a sudden onset as is an emergency, of course. The problem is a forward displacement of the iris, which it was mentioned in the video, which presses against the cornea and closes the chamber angle, suddenly preventing outflow of acute humor. That chamber angle is called the trabecular meshwork. Okay, so anyone can develop glaucoma, although some adults are higher risk, such as American, Hispanic, Latino Americans over 40 years of age, any individual over 60 years of age, those who have a family history of glaucoma, and adults who have high eye pressure, corneal thinness, and abnormality of the optic nerve. Health promotion and maintenance, and this is good to know. At this time, there are no ways to prevent glaucoma. The best prevention against damage that glaucoma can cause is for adults to have an eye examination with glaucoma checks done every 2 to 4 years before age 40, unless you have another condition, right? Every 1 to 3 years between age 40 and 54. Don't get confused with the regular eye examination. This is glaucoma checkup. Every 1 to 3 years between 40 and 54, and every 1 to 2 years between age 55 and 64, and every 6 to 6 months over the age of 65. Okay. The patient with glaucoma, the possibility or reality of the loss of vision can be distressing for patients. Numerous studies have identified a connection between glaucoma and anxiety and depression. So, it's very important to pay attention to all the factors within your patient, right? The history, not only the medications, the chronic conditions, the nutritional habits, but also this mental state. If a patient is having anxiety or depression, assess for glaucoma. If the patient is having glaucoma, assess for anxiety and depression. Assessing the cues history. Symptoms of acute angle closure glaucoma include a sudden visual loss, pain, conjunctival erythema, and corneal edema. In primary angle glaucoma, patients are often asymptomatic in the early stage. The visual fields first show a small loss of peripheral vision that gradually progresses to a larger loss. So when you go to the doctor, to the ophthalmology, there is a test in which you put your head in a capsule and they start lighting up little dots inside of that capsule, right? You're gonna have like a screen. It's a capsule with in the shape of a balloon, and you put your head inside and they are going to start lighting little dots in the peripheral area and in the front area. They are gonna give you a remote control, right? So every time one of the spots is lightened, you have to press the remote. And they can measure if you are having initial stages of glaucoma if you don't see the ones that are in the peripheral area, right? So if you only notice the lights that are turning on in the center or in the middle part, it's okay. But if you don't notice the one in the peripheral, that's a problem with glaucoma, right? Ophthalmoscopic examination shows cupping and atrophy of the optic disc. It becomes wider and deeper and turns white or gray. The sclera may appear reddened and the cornea foggy. Ophthalmoscopic examination reveals a shallow anterior chamber, a cloudy aqueous humor, and a moderate dilated non-reactive pupil. An elevated intraocular pressure is measured by tonometry. We spoke about that. In open angle glaucoma, the tonometry reading is often between 22 and 32. Normal, we know, is 10 to 20. So the earliest stage is 22 to 32. Okay. In angle closure glaucoma, the tonometry reading may be 30 or higher. So look, you have the normal pressure is 10 to 20. When the patient is having the open angle glaucoma, it could be between 22 and 32. And when it's a closed angle glaucoma, it's going to be above 30. Visual field testing by perimetry is performed. That's the test that I was telling you. As is visualization by gonoscopy to determine whether the angle is open or closed. Usually the optic nerve is imaged to determine to what degree nerve damage is present. So good to know about the how is the reading of the pressure in the eye. Okay, this is you need to know these numbers. Okay, non-surgical management. Teach the patient that loss of visual sensory perception from glaucoma can be prevented by early detection, lifelong treatment, and close monitoring. Use of ophthalmic drugs that reduce ocular pressure can delay or prevent damage. Drug therapy for glaucoma works to reduce intraocular pressure in several ways. Eye drops can reduce the production of an increase or increase the absorption of aqueous humor or constrict the pupil so that the ciliary muscle is contracted, allowing better circulation of the aqueous humor to the site of the absorption. These drugs do not improve lost vision but prevent further damage by decreasing IOP. That's important to know. These drugs do not prevent lost vision. When you get into a stage of glaucoma, some vision is lost already, but these prevent further damage by decreasing the IOP. The prostaglandin agonist drugs reduce IOP by dilating blood vessels in the trabecular mesh, which then collects and drains aqueous humor at a faster rate. Okay? Um, patient care, patient-centered care, older adult considerations, promote independent living with patients with impaired vision. You are going to teach about drugs, um, and the importance to be compliant with these treatments. Communications with large telephones, safety. For example, you're gonna throw drugs should be eliminated as this increase the risk for falls. All these considerations for the patient that is suffering from these conditions. Um, a microwave oven is a safer means of cooking than a standard stove, although some older patients are afraid of microwave ovens. Personal care, hand grip should be installed in bathrooms, yes. And I would recommend this for all ages. I mean, for all elderly. It's not only for people with glaucoma. After 50, this hand grips should be considered for all elderly people. Diversional activities, card games, domino, and some board games are available in large, high contrast print. Okay, because we need to make their life easy and enjoyable, right? Best practice, patient safety and quality care. Remember that they are in high risk for depression and anxiety. Care of the patient will reduce vision, determine to what degree the patient can see, describe food placement on a plate in terms of a clock face, and more activities to support their ADL. The priority nursing intervention for the patient with glaucoma is teaching, of course. Not only with glaucoma, I think with all diseases and conditions, but this condition causes a lot of anxiety and depression about vision loss. So you have to provide a lot of teaching. Teach the patient that the benefit of drug therapy occurs only when the drugs are used on the prescribed schedule. Therefore, patient mind still drops on time and not skip doses. That's most important. Um, know your medications, your prostaglandin agonists. Teach the patient to check the cornea for abrasion or trauma. Drugs should not be used when the cornea is not intact. Okay. Um, your timolol, for example, your beta adrenergic products, your timolol, or your lols. You need to check your heart rate and blood pressure, right? Teach patients who also take oral beta blockers to check their pulse at least per day and to notify the primary healthcare provider about any and eye care providers if the pulse is consistently below 60 beats per minute. These drugs potentiate the effect of systemic beta blockers that can cause an unsafe drop in heart rate and blood pressure. So that's good to know. I'm gonna test you on that. Um, Other medications, for example, the brinzolamide is a carbonic anhydrase inhibitors. Ask whether the patient has an allergy to sulfonamide antibacterial drugs. Drugs are similar to the sulfonamides. If a patient is allergic to this type of medication, an allergy is likely with these drugs, and that's good to know. It's all about safety, you see? Is the safety of getting a medication that can cause an allergy. If safety about a medication that can reduce your heart rate, okay, and blood pressure. Is safety about how we need to check if there is any cornea that is not intact. It's all about safety. You need to, whenever you study for the NCLEX, you need to be smart in this sense. Always focus your attention, always focus to pre-procedure, post-procedure, okay, nursing interventions and safety. You need to master that. Yes, it's good to know the concept of every procedure. Yes, it's good to know how the procedure is performed, what areas is touching, is covering, what areas are being, analyzed and checked, this and that. But you need to focus on the nursing procedures and safety. In terms of laboratory, know your labs level, your normal ranges. You don't need to know the ranges of the lab that put together can make a diagnosis, right? For example, if you have this RBC elevated plus these eosinophils elevated plus the other one, those three together means that the patient has certain conditions. No, that's not your job as a nurse. You don't need to diagnose. You just need to know your normal levels, okay? Um, okay. Most eye drops used for glaucoma therapy can be absorbed systematically and can cause systemic problems. It is critical to teach punctual occlusion to patients using eye drops for glaucoma therapy. Surgery can be performed when drugs for open-angle glaucoma are not effective at controlling IOP. Two common procedures are laser trabeculoplasty and trabeculectomy. A laser trabeculoplasty burns the trabecular meshwork, scarring it and causing the meshwork fibers to tighten. Tight fibers increase the size of the spaces between the fibers, improving outflow of aqueous humor and reducing IOP. Trabeculectomy is a surgical procedure that creates a new channel for fluid outflow. Both are ambulatory surgery procedures. So we know it's all about the trabecular meshwork, right? So we need to tie those fibers in order to allow a space for the fluid to run and to reduce the pressure of the glaucoma. Self-management education. The patient with glaucoma is usually managed in the outpatient setting and seen every 1 to 3 months, depending on how well controlled their IOP is. Teach the importance of good hand washing and keeping the tip of the eye drop container clean. Remind the patient to steal drops on time as recommended by the eye care provider and not to skip doses. For the patient who has had surgical management, teach the signs and symptoms of choroidal detachment and hemorrhage. This can occur during or after coughing, sneezing, straining at stools, or Valsalva maneuver. Serious detachments involve some degrees of vision loss, yet is usually painless. That's why we presented before the list of activities that increase intraocular pressure. Okay, so you need to avoid or reduce. I know it's kind of impossible. If somebody gets sick, the coughing is going to be every day, every hour. Sneezing, straining at stools, we can avoid that by having nice nutrition and easy bowel movement, Valsalva maneuvers. All of this is about nutrition. If you eat properly, if you have proper breathing techniques, okay, also that will help. NCLEX examination, take a look to these questions. Pay attention to those. The primary expected outcome is that the patient will have optimum visual acuity as long as possible, as demonstrated by adherence to the treatment regimen. Let's take a break and we will come back with part 4, chapter 42.